The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, facial plastic surgeon Dr. Yadro Ducic helps his patient improve her appearance and quality of life with a facelift. Learn more about the Texas Heart Institute and their doctors with interventional cardiologist Dr. Annie Varghese. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
All my life, I was the fat girl. Everywhere I went, I was the fat girl. I mean, even at work, I was the most heavy-set woman there was, and I didn't have the energy or the drive to do anything. I didn't want to leave the house because I was ashamed of the way I looked. My normal doctor put me on a weight loss program, and I lost 60 pounds, and then I continued with that, but I put 30 of it back on, and when I hit the 300-pound mark again, I just broke down and cried and said, I cannot do this anymore. And that's what led us to go see Dr. Barker.
Dina was certainly a candidate for any of the procedures. Patients can have just about any of the procedures they want to have. What I like to do is explain the different procedures, what their outcomes are, what the pros and cons are, and then have the patient make the choice. That way I think they own it, and it's really what they want after hearing the facts. In Dina's case, she chose the gastric bypass, which is a very good procedure for anyone, from a BMI of 35 to a BMI of 95. It's very well tolerated, swallowing is great, no reflux, excellent weight loss, and excellent long-term weight loss. I think of the three procedures, the band, the sleeve, or the bypass, the gastric bypass certainly has a more durable weight loss. And that's why it's always a good choice. If you get your weight back, you get your problems back.
Before I went to see Dr. Barker, I was 330 pounds plus, and I'm down to 156, and that's a total of 180 pounds.
Dina was actually so pleased with her surgery, and her husband Walter saw the results that he actually got interested in having the surgery himself and has done very well.
He explained to me briefly what the advantages of having this surgery, and from there we had my surgery scheduled, and it was gastric bypass as well.
So now they have kind of a little partners in crime. They can get out and do things, and their quality of life is just great.
It feels great to know that I've lost more weight than I weigh now.
Is your energy lacking? Though it may be the last thing you feel like doing when you're tired, exercise. Even a brisk walk can be more effective than a nap or cup of coffee at fighting fatigue.
How do you figure out you have a hernia? There's a couple of different types. There's the kind that we're born with that develop from very small openings in the musculature that with time and wear and tear tend to open up, and we can get our intra-abdominal contents and fat trapped within them. The usual presenting symptom is pain. The other type of hernia that we see is called an incisional hernia, where somebody's had an operation done before on their abdomen, and the area where the abdomen was closed has opened back up. And so this develops a new hole that, again, over time with wear and tear, will gradually stretch and cause that patient some symptoms.
I had a small hernia in my stomach, and I got a stomach virus and was doing a lot of throwing up. And within 4 days, my hernia had grown to be the size of my hand. So my family doctor sent me over to see Dr. Duffy, who immediately put me in the hospital and did surgery on me.
Jenna came into our office. She was having a lot of abdominal pain that she'd been suffering with for a while, And because of multiple other medical problems that she had, it took a while to figure out what exactly was going on. We diagnosed her with a hernia that she had in her abdomen, which is fairly large. We were able to offer her an operation laparoscopically. We were able to use a camera and very small instruments to repair this through 2 tiny incisions. And as a result, she was able to go home from the hospital the same day. She had much less pain as a result, and she was able to go back to work fairly quickly.
I'd had abdominal surgeries in the past, but this was very minimum amount of pain involved. Dr. Duffy was very explanatory to me and my son, who was there with me. Dr. Duffy was very likable when I first met him because he was so informative. In my visits and the few times I've had to call him after surgery for questions, he's been very nice about returning my phone calls and making sure I understood what he was saying. He just takes awesome care of his patients.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Hi, I'm Jim Knox, and a lot of people have asked me, hey, what do you do away from the ballpark? Well, I am co-founder of a company called Identity Media Services. Our Emmy Award-winning production team can brand your company with videos, commercials, radio, and television, and our digital performance program specializes in lead generation, websites, and reputation management. So if your business needs a lift, give me a call, because as you know, it is tough to stay on top. Whew, that's gotta hurt.
Find your doctor on bestdocsnetwork.com.
Ken has a question for Dr. Torrance Walker. What non-operative treatments are available for my knee pain, and when should I start?
The non-operative treatments available for you include anti-inflammatory medications, Tylenol. Some people find good relief from taking glucosamine and chondroitin, which is an over-the-counter medication as well. Other treatment options include steroid injections or gel injections, which lubricate the joint. Platelet-rich plasma has become more of a non-operative treatment for patients. Some patients find good relief with bracing for a period of time, and all of these treatments can be provided monthly or weekly, depending on how severe the patient's knee pain is. It can provide relief enough to help them be more active at this time with their arthritis.
Ask our doctors on bestdocsnetwork.com.
For years, I had been plagued with what I thought was just like a pulled muscle in my neck. And it just kept getting worse and worse the more I did and the older I got. And it just would not go away.
She was having difficulty running and doing the typical activities that she will do on a regular basis. Julie is someone that's very active. She's a runner, works out. As she was noticing that she was just not able to carry out the level of activities that she was able to do before, she came and sought some help. We got some pictures of her neck, and sure enough, we saw that she had developed pretty advanced degenerative changes of her cervical spine, and there was some bone spur that were pushing on the nerve.
He gave me all the information, and I walked out, and I kind of thought about it, and I went to physical therapy, still didn't work, and then that's ultimately when my husband and I went back in and talked to him and said, okay, this is not a way to live.
After failing to essentially improve on conservative measures, we decided to proceed with an anterior cervical discectomy and fusion. Essentially, that is a procedure whereby we get into the joint of the neck from the front and restore the height of the disc, clean up all the bone spur, relieve the pressure of the nerve, and fuse those diseased joints. We watched Julie in the hospital for about 2 days, and then after that she went back home, and she continued to just recover adequately.
I'm so glad that I did it. I've actually told some friends that have been putting it off, and they've gone to see him. They've had great results. Do you want to walk around constantly being in pain? No, it's not worth it. And sure, you got to slow down for 12 weeks, But now I'm back to where I was, and I'm very happy that I've done it. I just moved slowly and methodically, listening to the plan between Dr. Benet and the physical therapist, and here I am now. I'm back and even better.
Welcome. Today we're joined by Dr. Denton Cooley, a native Houstonian and the actual founder of the Texas Heart Institute. What a pleasure to be with you today, Dr. Cooley. Thank you for joining us.
Well, you're welcome, and thank you for visiting our institution.
Can you tell us a little background about how the Texas Heart Institute became an entity?
Well, it, I think, began in the mid-1950s when open heart surgery was first introduced in our Texas Medical Center. And before long, my program here at St. Luke's and Children's Hospital was probably the most prolific of all institutions in the country, including the Mayo Clinic, and Cleveland Clinic, and everything. And we had a simplified technique of open heart surgery and soon began a leadership position in this new field of cardiac surgery. Well, then I decided to create this institute in 1962. So it's been a little over 50 years ago.
What is your most vivid memory about the Texas Heart Institute, about any type of incredible learning that has been occurring here? What's your greatest memory?
Well, of course, our Heart Institute was created with two objectives, that is, research and education. So in each of those aspects of our history, I think there are certain exciting things that have happened.
And when the Texas Heart Institute first came into being, cardiothoracic surgery was high on the list of available procedures to be done for patients. Now we have the artificial heart and the LVADs. And so would you tell the audience about that?
Well, I think that it shows the evolution of cardiac surgery. First, we started off replacing just some of the components of the human heart. That is the valves and the great vessels, and modifying the ventricles and that sort of thing. And then the big breakthrough came in 1968 when we did the first successful heart transplant to replace the entire organ. And that was really an exciting period that followed that. It was such a new concept.
Amazing, right?
Yeah.
And we have actual volunteers here at the hospital who have been survivors from cardiac transplant for about 20 years now.
Oh, yes. Our initial work in transplantation, we did, I think, about 15 or 20 heart transplants in that early era. But so many of these patients suffered from rejection of the tissues. But in the early 1980s, a new breakthrough came with the development of a drug called cyclosporin, which is still in use today and has made it possible for some patients to survive transplantation for 20 or 30 years. So it's a really big change.
Quite miraculous, and you are such a part of that endeavor, and we humbly thank you for everything you've done for the world population, actually.
Well, it's been a great satisfaction to me to see how this institution and our whole medical center has grown during my lifetime.
Thank you, and now we're taking you again all over the world with Best Docs Network, and we just wonder if you have something in these closing remarks, if you can tell our public something about the Texas Heart Institute that you would like them to take to heart.
Well, I think that we have done a great deal to reach our original objective of research and education. But at the same time, we've made many advances in just clinical medicine and surgery, and have enjoyed a leadership position in this new development now. It has sort of inspired the entire medical community around the world. And you can find large cardiac programs going in Europe and South America and elsewhere in North America. Just amazing to see how rapidly it's expanded.
Well, for all of us who have trained under your great leadership, we humbly thank you, and we give you great honor, Dr. Cooley. Thank you for being with us today.
Oh, thank you.
Coming up on the second half of today's show, ENT Dr. C.T. Wynn relieves his patients' inability to breathe and nasal congestion by diagnosing their deviated septum. Learn more about the outstanding medical facility, Houston Northwest Medical Center. Cosmetic dentist Dr. Guy Lewis talks about his philosophy and approach to practicing dentistry, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I had the four front teeth were very crooked. Two were going forward, two were going backward. I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me. So I did some research. I don't know if there's cosmetic dentistry up there. I'm sure there are, but I just didn't investigate it. But I did investigate this one and thought, well, this looks like a good as any. And so I did some research, checked into it, and here we are.
Well, Ken had come from Cleveland, Ohio. So he sent me a lot of pictures and stuff before he came, and I knew I could help him out. And so he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put them on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps in the process because I live so far away. But very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works, I mean, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're gonna have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, hell, that's funny, something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family and my kids, I actually smile instead of, kind of half smile it. And they were always making fun of me for that. So, very happy with the results. The staff is very professional. That they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, come in and experience it, see for yourself. It really can be very pleasant.
Request an appointment on bestdocsnetwork.com.
Cardiac Cath Laboratory.
Our OB department has just grown through the years.
Here at Houston Northwest, we have a lot to be proud of, not only in the quality of services we provide, but in the scope of services we provide. We are the third largest ER provider in the greater Houston area, and we're the largest outside of the medical center downtown.
The attention to detail is phenomenal, from the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
Nick has a question for Dr. Paul Marciano. What are the causes and treatments for ingrown toenails?
With ingrowns, typically it's a cutting habit. Sometimes it can be caused by trauma. Sometimes discoloration or thickening of the nail, what we call fungus of the nail or onychomycosis, can cause the change in the nail where it makes it slightly more curved and it starts to grow out and dive into the skin, pierces the skin and causes the infection. So basically we offer two types of treatments where we can numb the toe up, in which we go back and remove the offending nail that's piercing the skin, causing the infection. That in itself is instant relief for the patient. And then for the patients that we find out that it's not really cutting habits, it's not a trauma issue, or it's not the thickening of the nail, it's genetics. The shape of the bone causes the nail to be slightly more curved, and when it grows out, again, causing the ingrown toenail on a more chronic basis, we offer doing a procedure where we can stop that side of the nail from coming back with a chemical.
Ask our doctors on bestdocsnetwork.com.
I was having neck pain that was shooting into my shoulders, and this had been going on for about at least 2 years. So I finally decided to come see Dr. Bannister.
Beverly had a common condition of degenerative spinal disease. And basically what that is her own bone spurs were compressing on her spinal cord as well as her exiting spinal nerves, giving her the pain and numbness into the distribution of the nerve, which depending on the nerve, it goes into a certain part of your arm, hand, and fingers.
I opted to go the surgery route, which was the right thing to do, and it was great. I mean, I'm so thankful I met Dr. Bannister and Sherry. They've been great to me. If he hadn't recommended the surgery, I do not know what kind of shape I would be in today.
The theory behind the fusion is then when the bone grows together, there is no more looseness of the disc that we think is one of the causes of this chronic neck pain, shoulder blade pain. And therefore they don't do this anymore because it's all in unison. There's not a lot of lost motion with this. People will hear You're going to fuse my neck. I can't turn my neck. And all of our actual lateral movement is base of the skull in C1 and C1, C2. So these people do not have functional loss of motion. In fact, oftentimes they feel like they're better because they have less pain and less spasm.
After the fusion surgery, I did not experience any of the shooting pain in my shoulders that I'd previously had. So right away I noticed a difference, within the first week or two.
This is a highly, highly successful surgery. Very rare for someone to not fuse.
I feel that Dr. Bannister's goal for me personally is to make sure that I can live my life not at 50%, but at 100%. He's told me that time and time again, and he would not stop and will not stop until he knows that I am back to living my life pain-free and happy and doing well.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Find your doctor on bestdocsnetwork.com.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
Watch more videos on bestdocsnetwork.com.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple course of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.